Growing up, I was taught that medications treat and fix the underlying medical ailment. But what happens when the medication temporarily relieves the problem and causes more side effects? Well, typically you are given another pill for that side effect, and before you know it, you are taking numerous medications just to treat the ever increasing cycle of new side effects. I say all of this because there are some unusual side effects that everyone should be aware of. Alright, so first let's talk about some medications and some common side effects that you more than likely have experienced or taken some of these medications at some point in your life. This doesn't apply to all medications, but these are just, once again, common side effects, common medications at first. Then we're going to go into some of the strange medication side effects that are a little bit more intriguing. So that'll be a little bit later in the video. So first, let's go over medications that have caffeine in them. So there are things such as aspirin, Excedrin, and there even are some migraine medications as well that have caffeine in them. So the big thing with this is if you're a big coffee drinker, that can cause anxiety and increased heart rate in itself. But you add some of these medications in there that have things such as caffeine in them and even things such as aspirin as well, this is just going to add up and can cause more anxiety. So you're going to notice that at first, what we'll be discussing too is these medication classes we're going to be going over, most of them are primarily that they have a stimulant effect with a common side effect of anxiety. So if you're somebody who has a predisposition to anxiety, you might want to look at some of the medications you're taking. And some of them obviously you can't avoid depending on the circumstances of sickness and whatnot, but this would be something to talk to your doctor about as well. So once again, aspirin, Excedrin with caffeine, these things have a stimulant effect in them. You drink coffee with that as well, that can double it right there and make that anxiety even higher. Once again, as stated, there are as well migraine medications that have caffeine in them as well. So that as well can increase that heart rate, that blood pressure as well. So that's the first classes, medications with caffeine. Common ones, once again, we'll repeat, are aspirin, you have Excedrin with caffeine in it, and some migraine medications. Second class, corticosteroids, things such as prednisone, albuterol even, so if you have asthma, which once again, this is why these are things that you cannot avoid. Prednisone if you get sick, if you have things such as rheumatoid arthritis, it helps decrease that inflammation. Don't just stop these medications, obviously, but sometimes some of these side effects it can cause are things such as anxiety. Now, as well with this, cortisone, and not really the cortisone cream I'm talking more so those cortisone injections. One side effect of that as well, that is fairly common, surprisingly, reducing inflammation and pain, but also is reported, once again, is anxiety and restlessness. According to, so what I've read as well, and just doctors I've talked to on this, they don't really know a scientific reason in regards to why anxiety is a side effect of this. But what I can tell you though is, one thing that can happen though is when you're getting off of some of these things, for example, like prednisone, let's say, for example, like I've said in the past, I had mono, they put me on a week of prednisone, which is a corticosteroid. Helped a lot with energy, and I've done a video on that. I'll link it in the video about prednisone, what can happen with it and some side effects as well. But for example, with prednisone, what happened with me was, I was tapering off of the medication because you don't stop corticosteroids cold turkey a lot of times, things such as prednisone. And one thing I noticed as it was being tapered off, I noticed I was a little bit more irritable. My anxiety was a little bit higher. Little tiny things like that would irritate me. The littlest things, if the TV was too loud. I also kind of noticed my senses were off a little bit too, I felt like. So the reason for saying this in regards to why scientists don't know what's going on, because once again, reducing inflammation with corticosteroids, they don't know, but there is, at least when tapering off of them, you can have that rebound anxiety effect, because corticosteroids, hormones that are essentially helping replace that it can help with cortisol, and also it can help as well with reduced inflammation. So big takeaway with this, in my opinion, is, once again, anxiety can happen, but if you're taking once again a corticosteroid and your anxiety's been higher, don't just stop it, once again. But also with this, always talk to your doctor, and you can ask them if there's anything they've heard of. Why am I having anxiety while taking this medication as well? But yeah, this is the first class we're going to be talking in regards to side effects from medications that primarily cause things such as anxiety, paranoia, racing thoughts, like that. The third class, and this goes towards children and younger adults and adults in general. So if your child, for example, is reporting this to you, they're having higher anxiety levels, sometimes can be ADHD medications. ADHD medications, essentially, they are stimulants. They are technically, they're amphetamines. They're amphetamines, not methamphetamine. They're amphetamines. What they do is they essentially, what they'll do is they'll raise your heart rate. They will also increase your blood pressure as well. But what they're really doing is helping balance your dopamine back out in your brain if you have ADHD. Because a lot of what the science is saying with ADHD is your dopamine levels aren't balanced, and that's why it's hard to focus. So once again, taken for focus. Things such as Adderall, Vyvanse, Ritalin, things such as this. I'm not talking non-amphetamines here, just amphetamines on this. But one thing as well, one interesting thing that it can be noted is if sometimes people, and if you're taking this, once again, if you don't have ADHD and you're just taking it to take it, that's probably why it's causing anxiety. But another common side effect from somebody who's taking it, who's been diagnosed with it and has a prescription for it, is when it's wearing off, having anxiety coming back. A lot of times for people who do have ADHD as well, what can help with this is sometimes actually a cup of coffee. Because when you have that drop in that dopamine, when you have been balancing them out, and it helps, and it's helping cognitively or helping you think, when you're coming down from it, that can cause things such as irritability. It can cause mood changes, things like this. So trying to balance it back out and not having a cup of coffee too late in the day sometimes can help. But if you're noticing anxiety that is there from when you're waking up, or even not when you're waking up, from when you're taking it and throughout the day, and you've had no relief from your medication, that'd be something to talk to your doctor about, because one thing that can lead to is more paranoia as well. And then also you might be having sleeping issues as well, which then can lead to other things such as it can lead to things such as psychosis in the extreme example. But big thing, looking out, especially for kids as well, are there any changes in their behavior? Is their impulse control actually being controlled? These are side effects to look out for. Is it actually helping them focus? Are they able to still create social relationships? And this also goes towards adults too. So if you're noticing, like, you used to be going out and you're taking this new medication, let's say you're taking something like Vyvanse, and you notice, yeah, you're focusing, but you feel like socially you're feeling awkward, you don't want to do the same things you used to do, that is healthy things, that'd be something to go get checked out, because you don't want that to lead to anything that's any worse. So that's another thing that's very important, that are common side effects from ADHD meds, in particular the amphetamines medications. Now the next class, I'm going to briefly hit on these two. Thyroid medications, in particular for hypothyroidism. Once again, if your thyroid is not producing enough of the thyroid hormone, essentially, you're going to have things such as weight gain, and this is hypothyroidism, weight gain, irritable in itself, and you'll notice too with it, sometimes a pudgy face, things like this will come on. Now, when you're taking something for hypothyroidism, like levothyroxine or something, like, let's just throw that one out there. For all the hypothyroid medications, common side effects, because it's a commonly prescribed medication and it works wonders. It treats the condition, but it runs in family, so it's hereditary. Runs in my family as well. Is side effects are anxiety, shakiness, and a big one, mood changes to an extreme, but hyperactivity. Sometimes a little bit of some impulse control issues is a big one, but the big one, in my opinion, is the anxiety and shakiness from it. I've even seen this. I've had patients before in the past say when they've started the medication, everything seems fine and dandy, and then from there, anxiety and shakiness, and even some panic attacks as well, surprisingly, can happen with this. If these are happening, go talk to your doctor, because they might adjust the dose a little bit for you as well, which can make a huge difference. So go talk to your doctor about that as well if you're noticing it in the shakiness as well. And what I mean by shakiness is not just hand shakes, but also like some body shakes as well. You feel hard. It's hard to sit down. You feel not like you're losing control, like using a pencil or anything. Nothing like your fine grips, but more so just hard to sit down. It's hard to stay still, like you've had a million cups of coffee. That can be a common side effect. I wanted to throw that in there just because it is a commonly prescribed medication that you have to take. If you have hypothyroidism, you're going to have to take something for it. So another one. This is generic, but I wanted to throw this in here, seizure medications. So essentially what seizure meds are doing, and this is just generic, is it's calming that electrical activity in the brain, because what a seizure is it's an imbalance. Essentially, with what's going on in your brain is the electrical stimulus, it's uneven, causing seizures, losing control. It helps balance that. It helps balance what the seizure meds will do is they sometimes don't prevent seizures, but it'll help balance and reduce the amount of time a seizure is going on and help prevent seizure activity at all. But it's an imbalance of that electrical activity going on in your brain. I know that's kind of generic, but I just wanted to go over this because some of the side effects are really important. A lot of these seizure medications cause things such as anxiety is a big one, agitation, paranoia, and the big one as well is panic attacks. The interesting thing about panic attacks that I find with seizure medications, having patients in the past with this, a lot of them that take these seizure medications, it obviously helps with the seizures, but one side effect of this is their impulse control, their agitation, and high anxiety causing panic attacks is common, which sometimes inadvertently it helps prevent seizures, but through having these panic attacks, through these side effects of these medications, it can actually induce seizures as well. These side effects induce seizures at a lot lower rate than actually not taking anything at all, but that's something you need to be aware of as well when it comes to common side effects, because seizure conditions in general are very common today. Now, the next part, like and subscribe. We're going to go over this shortly, but this is what I really wanted to go over real quick for everyone, is let's go over right now 4 strange side effects from 4 different medications. All right, so this first strange side effect comes from Requip or ropinirole, which is a medication. It's a dopamine agonist, which helps balance those dopamine levels in your brain. It's used for things such as restless leg syndrome, which I know a couple people that take it for restless leg syndrome, Parkinson's disease, and severe muscle tension, or just in general, severe muscle aches. It can be prescribed short term. But one interesting, strange side effect that came from it was one thing they found that was common is impulsive behavior. And in particular, in the study that was found, one participant who started taking it ended up developing addictions to things such as sex, and also meaning hyperfixating on sex, excessive sex, and also gambling. So the whole point was activities that in the past sometimes that people like, it ends up flipping opposite on them, and they'll do things that are more impulsive. So if somebody's a lot more conservative and they are now taking this, it can flip and you can become a lot more, sometimes not extreme, but conservative to more so in a way doing things outside of your comfort zone that you normally wouldn't do. So that's the first one, ropinirole or Requip. The next one is amitriptyline or Elavil. This is an antidepressant. Today it's still used, but it's not really used near as much as like an SSRI or an SNRI. Once again, it's a tricyclic antidepressant. It will be used if your traditional SSRIs or SNRIs are not effective. They will try this. But one interesting thing about this is the dyes that are in the medication, because this medication has dyes in it, it'll make it where for some people your urine will be blue. They say this because it sometimes can change. The dye essentially can tamper sometimes with with the body fluids and cause things not like blue sweat or anything, but in particular blue urine. So if you're on a TCA or amitriptyline in general, different color urine, and I'm not saying like it's typically like it'd be like a blue or even kind of a purplish to it is reported. So don't freak out. This is one reason we go over this, because these are sometimes side effects that, once again, doctors are not telling people. Like, they're not saying they're not telling them about it. They see so many patients a day, but these are things that sometimes you have to know on your own. And this is why we're going over this, because these are side effects that if this did happen, you would want to know just for your own sake, and you wouldn't freak out and go, oh, I need to go to the ER right now because my urine's blue or something. But yes, it can cause that. Or if you're having blue urine in general, which I don't think you are, if you're taking this, this might be the cause. The next one we have is Ambien. Now, Ambien, it helps. It's a sleeping medication. I'm not going to go too in depth in this, but it helps you fall asleep and stay asleep. Now, one thing about Ambien that I find that's very interesting is a lot of times with it, it's sometimes when you take the medication, it has a rebound effect to where you actually have impulses and desires to actually do activities while, like, right after taking it. That's why they tell you to take it literally when you get in bed, to take it last thing, because there have been cases, and a side effect of it is having urges and impulses to want to go and do things like go to the kitchen, go eat, do an activity. And the problem with that is too, or even driving is, you get in your car and you go drive, fall asleep behind the wheel. So, and just in general, if you do stay up while you take Ambien and try to do things, a higher chance of something very serious happening to you could potentially happen. So that is a side effect of Ambien. It's a commonly prescribed sleeping medication that everyone should know about if you're taking this medication. Is to take it right before you go to sleep, because sometimes it can give you impulses to want to do things even though it's about ready to put you to sleep, and then you black out, you fall asleep, and you end up on the road, or in your car or whatnot, or passed out in your kitchen. Just take it right when you're in bed, literally right before you go to bed. If you have to take it in bed, sit up for 20 minutes, get a book out and read, and then go from there. Last one that's really important is Depakote. Now, this one I wanted to put in there because working in a psych hospital, it is a commonly prescribed medication that treats things such as epilepsy, bipolar disorder, and in some instances, migraines. Migraines I can attest to because I know somebody that was prescribed this for migraines, although testing was not done because they should be doing your blood levels before just giving this medication out. So it can be given in cases of migraines where if migraine medications aren't working near as well, or they think you're seeking medications, they'll do that. But the interesting thing is, for some people, and they don't really know the exact reason why, but it can actually make straight hair curly, which is very interesting. And scientists think that it's potentially a decrease in the concentration of certain substances or hormones that you're producing, which makes your hair curl up. And the interesting thing about this is, that's what they think at least, they don't know for sure, but the interesting thing is when people got off the medication, it went back to how it was, where it went back to straight again, the hair. So that's very interesting. So if you're noticing your hair like being more curly, and what I mean by curly is actually like not just wavy, curly, are you taking Depakote or valpyric acid? Same thing. That can happen. Also really important, this isn't a bizarre side effect of it, but one thing to note on Depakote, paranoia, delusions, and psychosis can be a common side effect of it, or if your dose is too high, you want to report that immediately, because that can lead to some tendencies that do not have good outlooks in general, where you're having thoughts of wanting to do things, harming yourself, etc., etc. So you'd obviously want to report that to your doctor to get off that medication immediately. But that is your video right there on medication side effects, common, and then we do the strange side effects. Like and subscribe, leave a comment. I don't know what the next video will be about. We're going to be doing the one on a celebrity soon, just his life story. We're going to do a lot more just mental health videos in general. We'll be doing drug addiction videos as well, medications that could lead to addiction, everything mental health related. You know that. But I hope you like this video. I appreciate all the support again. Like, subscribe, comment. Let me know if there's anything you're wanting me to cover. But yeah, this is all things mental health, all medications, drug addictions, medications in general. It's all things mental health, because all medications you take, there are mental health implications with it, and we'll also go over the physical health implications as well. That is your daily dose of mental health. Have a great weekend.